I think in another 10-15 years there will not be a rotary system. Dentists, all medical professionals are very much ignorant about taxation, about banking, about accounting.
So you had a lot of interesting controversies.
Seriously?
Yes. So you had a lot of interesting controversies.
Seriously?
Yes.
Against me?
Yes.
Okay.
So how did you manage to dissipate them?
Regarding controversies, I think, Prince, it's a part of everyone's journey.
Okay.
So if you're doing something, definitely there will be some controversies against it. Some people will be disagreeing with that. So that's quite obvious. So it's all about how you perceive it. I always take it in a positive note. There will be certain controversies or certain arguments against the things which you will be doing. If it is good, you can take it up, you can correct it. So other than that, if you're asking me, I'm a very sentimental person, but I'm not a sensitive guy. Sentimental means whoever is very much attached to me, we call it as well-wishers. I'll make sure that those people are very much satisfied with the things which I'm doing in a day-to-day basis. But we can't leave satisfying everyone around you, not only me, including you, everyone. You can't leave satisfying everyone. So obviously controversies will be there. So I think it's a part of everyone's journey.
Okay.
But you asked me, I was a part of a lot of controversies.
Yes,
I didn't understand. If you can enlighten me, I can help you on it.
Yes, sir. So there was one controversy, the famous one, especially the bill which was circulated, which went viral throughout the world.
Oh yeah,
Yes.
I do remember that. It happened in 2017. That was a central incisor, totally calcified, referred from one of my referral dentists from Perimbau. The patient was an engineer, and once the treatment was done, she was happy with the treatment and she had paid the bill. I always disclose my charges before I start the treatment, so patient didn't have any issue. But one of the friend of my patient is a dentist. They were schoolmates, and she asked how the treatment went and how much was the charge, and she said this is the charge, and she asked whether you can email me or WhatsApp me that bill. And my patient had WhatsApp the bill to her, and she had put it in her BDS group, and I think that's how it had circulated worldwide.
Yeah.
To be honest, that day and the next day, my WhatsApp messages were full. People known to me, dentists from India and abroad were messaging and sharing screenshots of the discussion that's happening in various groups. So there are certain dentists or people who are favoring those bills, and there are people who are against it. So I think that's not a part of things which I'm really bothered about, because I do it honestly, I do it transparently, and I'm doing my work. I have done my job with my best of my ability. So I don't have any regret to it.
Okay.
So even though bill was circulated worldwide, we can take it in a positive note. That root canal point is known to everyone.
Yes.
So it's a marketing way.
Marketing way, yeah.
So to be honest, I didn't market it like that. It just happened. So it's all about how you take it. I always take it in a positive way. In one way, it is good because root canal point is known to everyone.
So most of the cases which come to you are referred cases, especially the ones which is goofed up or messed up by a fellow practitioner, a dentist. So you have a situation where you have to defend the fellow practitioner, and at the same time you have to answer to the patients whatever doubts they have. So how do you manage such cases or such situations?
It's actually a little tricky situation because you need to satisfy both the patient and the referring dentist. But coming to a question, you asked how do you defend the referring dentist? I don't defend them. because I think when you're defending them, you are masking something. So masking something is not good because it may be masked for the time being, but unfortunately all families have a dentist now. I think if you take your family, at least one of your first cousin will be a dentist. So you can't mask anything at this point from a patient. Maybe 20 years back you will be able to do that because dentists were not accessible. But now at this point, if you have any issue, dental issue, which you had faced from another dentist, you simply send the x-ray to your first cousin. And your first cousin is gonna tell the honest answer to you rather than defending a fellow dentist who is unknown to them. So obviously you can't mask anything. So I'll generally put it this way, consider it's a fractured file. I say fractured file can happen. It had happened to me also. It could be because of many reasons. It could be because of acute curvatures and there could be calcification. So I will tell the fact that it is a possibility that can happen. It's not purposeful. And why the general dentist or your referring dentist had referred you to here is to give better treatment for you. So obviously the referring dentist value you and that's why they are referred to you, referred you to me. When you put it this way, I don't think any patient have any issue. So I'm going to satisfy both of them, both the patient and the referring dentist by answering like that. So this is one example of fractured file. It's actually a little tricky, but this is how I do it.
So when it comes to the future of endo, what are your thoughts?
The future of endodontics, I would say we will do endo, we will still continue to do endo, but in a very minimally invasive manner. I would say it's we will be doing it in a biometric way, trying to mimic the nature. So we will not be shaping the root canal like the way we are shaping now with rotary files. So I think in another 10-15 years there will not be a rotary system.
Okay.
Primarily because why we shape the canal is to enhance the disinfection. So shaping is not helping us to achieve disinfection directly, but indirectly it is allowing the better irrigant dynamics. But right now we have technology to achieve the disinfection with irrigants without shaping. So maybe in another 10-15 years, it's just a matter of time, we will be disinfecting the canal and filling it without shaping. So I think we will be still continuing to do endo, but in a very minimally invasive manner.
Okay.
So to extend your question regarding my specialty, it's a respiratory division also.
Okay.
I think the future of respiratory dentistry is also very bright, primarily because the focus of the current generation is more about beauty. So if you ask me how much time my grandmother take for dressing up for a function, I think it's 5 minutes.
Okay.
But right now if you ask me how much time my wife take or probably your wife take, I think it's around 30 minutes. It's not only about our females but also about men also. So beauty, the concept of beauty is changing, and one of the factors that determines beauty is teeth. So obviously that everything comes in restorative dentistry. So the future of restorative dentistry looks very promising because it's all about beauty and charm.
So you've been doing a lot of challenging cases, and I'm sure you employ a lot of equipments. Can you give us the list of the modern equipments that you use and also the price range?
The common equipments that we use for managing such cases, in particular endodontics, is the scope, the microscope. So the microscope, the price will be ranging. It's a range of price from 3 lakhs to as high as 50 lakhs. So it's like car. So you can get a car for 5 lakhs and you can purchase it for 5 crores. It all serves the purpose of traveling. Likewise, microscope also will give you enhanced vision. So the adjuncts what you get along with that makes a difference in the price. You know, other than the microscope, I do have other little complicated equipments like sandblasters, ultrasonic units, a few instrument retrieval kits, and the list is endless. And these equipments are expensive, very delicate, so we have to use it with a lot of caution. But more than these equipments which I had listed out, including the scope or sandblaster or the ultrasonic unit, what is more important than the equipment is the knowledge and skill of the dentist. So I'm always a fan of Top Gun film, Tom Cruise, a recent one, the Mavericks, yes. So I always like the statement from that is, it's not about the plane, but it's about the pilot. So just like that, it's all about the dentist. It's not about the equipment. So I'm not undervaluing the equipments. It's very important for us to do better work, but you all have to realize the fact that it's an adjunct that will help the pilot to do a better job. So the most significant factor that we should invest is to ourselves. So if we are good, definitely you can do better job. And definitely equipments are required to make it in a better level.
So many practitioners, they would like to settle abroad, especially in the Middle East or the West. Why do you think the dentists choose staying or practicing abroad?
I think the major difference what we get over there from here is the quality of life, and probably I will say the remuneration also. So these are the two things that attracts all of us to migrate to Middle East and Western countries. So you will get higher pay and you can achieve better quality of life. But I think we can achieve those things here also, but you need to work a little smartly. That's it.
Success is not guaranteed in any field. So most of the dentists, they spend money and time to finish their graduation and post-graduation, and finally they borrow money from the parents and they set up the clinic. But after some years, they fail to thrive. And also there are some doctors who earn around 3 to 4 lakhs, but the profit or the takeaway is just rupees 10,000. So why do you think there is a mismanagement of the financial system here?
That's about primarily about the success. I think in dentistry, success revolves around 4 factors. Those factors includes, number 1 is a setup. So if you have the money, you can have the setup. The second factor is a knowledge that you will not get with money. You have to put some effort. The third factor is skill, clinical skill, because it's a skilled profession, we call it. So you need to have skill to do better work. So obviously the third factor that will help in your success is skill. And the fourth factor, which actually is not being taught in dental school, is the communication skill. So these are the 4 factors that will help us to become a successful practitioner. Now the irony about the dental practice is, consider one person have the first, second and third factor who doesn't have the fourth factor. That means he doesn't know how to speak. He will not be successful. And the funny part is, consider another dentist who doesn't have the first, second and third factor, but only have the fourth factor. That's he know how to talk. That clinician will be successful. So one of the important factor that we generally we overlook is the communication skills. So if you have a better communicator, along with the skill, the knowledge and the setup, you can definitely thrive at your practice. So to summarize, I can say competency. So if you are competent in your skill, in your knowledge, in your communication skill, you definitely will be successful. So coming to a second part of your question, why someone earns 4 lakhs rupees, take home only 10,000 rupees. So I don't call such dentists are unsuccessful. They are definitely successful, otherwise they will not be earning 4 lakhs. But there is some problem in the way they manage their money. And I would say again, that's something that we missed during our undergraduation and post-graduation. That's about financial management. We dentists, not only dentists, all medical professionals are very much ignorant about taxation, about banking, about accounting, and other things which involves in running a business, profit and loss and other things. So I think we should dedicate some time in learning these things, so that at the end of the day you will not be taking 10,000 rupees, but maybe more than that, which will enhance your quality of life.
So you're a husband, a son, father, a clinician, academician. You're a speaker in various conferences. So how do you manage this work-life balance, and how do you prioritize things?
I won't say it's a balance. I initially thought it was balancing things, whatever we are doing. But I would say a better term to be used is harmony. So we call it as living in harmony. Now, living in harmony is nothing but, if you are considering me as an example, I teach in college. So that's one part of my job. I visit as consultant endodontist to few dental clinics. That's another part. I have a family, so my son, my daughter, my wife, my father, mother. So we have to dedicate some time for them. I have a lot of friends. I have UG, PG, and other friends. So I'll be spending some time for maintaining my friendship. Then I'm a social being, so I have some social commitments. We have to dedicate some time for the spirituality. And more importantly, I think we need to spend some time for ourselves also. So to make everything harmony, that means my students are saying I'm a good teacher. My consultant doctor is saying I'm a good doctor. My patients visiting my clinic are saying we should go to him. He's really good in his specialty. My family is telling, I'm very proud to say you as my husband, or you as my son. My research activity is speaking about me. So if consider that every aspect of this is satisfied, that's what we call it as living in harmony. So I think more than telling it, making it balanced, I think a better term to be used is harmony. Now it's not easy to make everything harmonious around you, but it is not something that is beyond. And I think one of the important factors that will help all of us to achieve that harmony is how you manage your time, how you prioritize your time. So I have my own way to prioritize it. So I give priority to one of the factor which I had mentioned. Then I have the second factor, third factor. So I dedicate time for each and everything, and I work with time. So time management is very, very significant to live in harmony. And I think that will indirectly help us to achieve that the work-life balance and live in harmony.
So your primary focus is to preserve the natural teeth, and your clinic tagline says preserve root, cherish teeth. So what is your main motto behind this?
The motto behind it is quite simple, and that's there is nothing that can feel and perform like a natural tooth. We all know that the best substitute for a natural tooth is implant. But we have to understand the fact that implant can never feel and perform like natural tooth because it doesn't have pedial ligament. So that's the whole rationale of putting this motto, that is preserve roots, cherish teeth. Because with the help of perio, resto and endo, I think it's possible to preserve a badly mutilated tooth, even can be preserved within the oral cavity. And I think in my clinic at Root Canal Point, we have a team to take care of all these specialties, which will preserve natural tooth within the oral cavity. The restorative and endodontic part I'm taking care. The perio part, Dr. Mejo Ambukan and my junior periodontist, Dr. Achu, is taking care. And the prosthodontic part, Dr. George P. John is taking care. So I think with their help, I had able to preserve many teeth within the oral cavity, and probably had given a second chance for many teeth to survive for a longer time.
So you have achieved many milestones, especially during the early stages of your career, the national awards and many other awards. What is the secret behind this?
The secret behind my achievements, the awards and other things, I don't think it's primarily because of my things which I have done. I think it's multifactorial. Any success is multifactorial. It's not individual based. So what are the main factors involved in my success? I would say number one is the correct guidance. So if someone gets the right guidance at the right time, you will achieve success in a much faster pace. Now, other than the guidance, I would say the help rendered from your family, the support from your friends, and many more actually contribute to the success. So I think for me, I was fortunate to get the guidance, the support, the help from my family, from my friends, from my teachers in the right time, and I got it in the right environment, and I think that's the reason why I could able to achieve all these in a very short period of time.
Thank you so much for spending your precious time with us. Any final message for our viewers?
The summary of the entire Q&A will be the message. The summary is you just keep yourself updated. That's very important for us to work with power and make it transparent, make it honest, and practice with ethics. I think that's a summary for me, for all the audience, for this particular YouTube channel of yours. And I wish you all the best.
Thank you.
Thank you. Thank you for the opportunity.
So dear viewers, that concludes our session, and I'm sure this episode will be of a great value, especially for the young aspiring dentist. And I would like to thank Dr. Jojo Kottoor once again from the bottom of my heart. If you find this episode interesting, please do like and subscribe and share this with your friends. Until then, signing off. See you in the next episode. Dr. Prince.